Hi everyone, I am Claire Kingsbury and I will be starting off the presentation for our group. Our public health hot topic was climate change. So just to give you guys a little broad overview of how we will be presenting it to you, I will first talk about exactly why climate change is a hot topic in public health. Then I will have Grace come in and she's going to talk about how significant these problems of climate change are and what issues are going on right now. Then Barang will come in and she's going to talk about who's addressing these issues and what we are doing right now to try and fix or tackle the problem of climate change. Finally, Corinne will come in and she will discuss some critiques about these current policies and what we can be doing to better impact better our impacts on climate change in the coming years. Finally, I'll come back around and I will discuss 3 areas that we really thought were a priority for action and what we thought could be making the biggest impacts in the coming years by focusing on these 3 areas. All right, so again, I'll just be going over briefly why climate change is a hot topic right now in public health. But before we do that, I'm just going to give you a little background on climate change. So it affects everyone and everything on our planet. This includes ecosystems, animals, plants, just about anything you can think of, it's being affected. Climate change has also had a lot of discussion. I'm sure all of you are fully aware of what climate change is, and I'm sure you've heard about it multiple times in the recent years. Unfortunately, there has not been a lot of action, and this causes a huge problem because urgent actions are very much necessary in order to tackle climate change. Just to dive into the public health realm a little bit, climate change affects the social and environmental determinants of health. So if by addressing climate change, we're actually also directly addressing public health, which is great. And then just to provide a real life example of this, obviously water and air safety directly affects our health. So if we think about Hurricane Ida, that left record rainfall in New York, consequently leading to flash floods, power outages, and even death. All right, so this is the first article I pulled that's pretty recent, came from the Times. And you'll notice that I pulled out some quotes from the articles that I thought really stood out to me. And then there'll be bolded words that should also stand out to you guys. This article really talks about why climate change isn't just a global issue, but very much so a public health issue. I'll go ahead and read these quotes. As climate change continues to alter disease patterns and disrupt health systems, its effect on human health will become harder to ignore. There can be no discussion about climate change without meaningful conversation about public health. And finally, we need policy changes that drive a just transition to clean energy economy and protect vulnerable communities from the impacts of climate change. All right, and then this was an audio clip I found actually just driving one day. It came out September 7th. And again, it focuses on why climate change is such a big issue within public health. So I'll go ahead and play that for you guys now.
The editors of more than 200 leading medical journals have released an unprecedented statement. They say the biggest threat to public health is climate change, not the pandemic. The editorial says rising temperatures could cause, quote, catastrophic harm to health that will be impossible to reverse. Together, they are calling on world leaders to take immediate action. NPR's Lauren Summer has more. Hurricane Ida hit hard, but most of the deaths in Louisiana caused by the storm had nothing to do with wind and rain. Several had to do with generator safety. With the power out, many are using generators. A week after the storm, Jefferson Parish President Cynthia Lee Shang held a public briefing.
The tragedy that we have had is that we have had more deaths post-storm because of improper use of generator use and carbon monoxide poisoning.
It's an example of how days after the storm hit, the most vulnerable are still at risk. The parish has also been transporting residents around who need dialysis and other medical care.
What people don't get is the impact that has on health and on public health.
Dr. Eric Rubin is the editor-in-chief of the New England Journal of Medicine. He says public health officials see the effects of climate change every day. Wildfire smoke sends people to the ER. Heat waves are getting hotter and more frequent. They can each cause hundreds of deaths.
The pandemic is awful, but it is something that we have the tools to control. Climate change may be the biggest threat out there to health, to public health, to our ways of life.
Rubin joined the editors of more than 200 other medical journals in an editorial that's calling on wealthier nations to make bigger cuts in emissions.
There are things we could do, and we should be doing them right now. So I'd like this to be more of a call to action. than an obituary on our planet.
Scientists say the world is currently not on track to avoid the worst impacts of climate change. World leaders will be gathering in November for the next round of climate talks. Lauren Summer, NPR News.
Okay, so I thought that audio clip did a great job of just presenting how severe weather and global warming actually gives lead to health issues, and that's why climate change has become a public health concern. They also mentioned Hurricane Ida again, which brings me to my next article. So this was pulled from the New York Times, and I'm sure as some of you may have experienced if you are local to New York, Hurricane Ida brought a heavy storm and caused record amounts of rainfall. I've also included a little picture here of the subway system to show just how drastic the floods were. And this article does kind of dives into talking about how our current infrastructure is just not sustainable for the foreseeable future weather events that will be occurring. And as you can see, clearly our subway system was not sustainable for this storm. All right, and then this is just a broad overview globally of kind of how we're doing. This came from the Climate Action Tracker, which can be found, it's pretty cool. You can find it at climateactiontracker.org. Corinne will be going a little more in depth on this and kind of go per country, but this gives you just an overview of how we're doing as a world and how we're doing on our goals that we've set and if we are reaching them. And unfortunately, as you can see, we are not anywhere close to where we need to be.
And now we have impact on health outcomes. As a result of climate change, we see more extreme weather, rising sea levels, increasing carbon dioxide levels, and rising temperatures, which result in negative impacts on our environment. And these negative impacts result in poor health outcomes for us and increased incidence of disease. We have air pollution, particularly ground level ozone is tied to climate change, but also our actions of burning fossil fuels result in fine particulate matter. These will cause around 60,000 deaths in 2030. We also have environmental instability, which is the exposure to harmful chemicals, increasing risks of disease, mining, and other land degradation as a result of climate change causing the environment to not be what it was. So in particular, thinking about crops that won't grow in certain areas anymore and trying to get them to grow there will result in further increased use of pesticides and fertilizers. We will also see climate change impact vector-borne diseases in two ways, particularly. There will be longer warm seasons, which gives more time for the vectors to breed. So the longer we have warm, still puddles, the longer mosquitoes have to breed and increase their numbers, which increases our risk of exposure to diseases like malaria, dengue fever, and Zika virus, and any other thing mosquitoes carry. We will also have increased global temperatures, which will allow for these vectors to have more of a geographic spread or even just change entirely where they've been. So historically, ticks have been in the northeast of the US to mid and even on the West Coast. Not really in Canada. In 2050, it will kind of creep into Canada. Their geographic spread is projected to be habitable for them based off where they're currently living. And in 2070, we'll see them really far into Canada. So making sure healthcare workers are aware of the risk of exposure to Lyme disease as a result of tick populations coming in. We'll also see more uncommon severe weather events, such as the Texas winter storm happening in February 2021, which is directly tied to the jet stream wavering, which is shown to be caused by the temperature differentials between the poles and the equator becoming less and less. And this had 111 deaths directly linked there. Increasing number of people are harmed by flooding. By the time Hurricane Ida got to New York City, it was just a tropical depression, yet it caused havoc on the subway system, as Claire mentioned, bringing the city to a standstill. It's not the only place, though. Germany had its summer of flooding, and Liberia had an increased rate of flash flooding. While the toll deaths are relatively low, the more frequent these are, the death number toll is going to climb. And also thousands of homes are destroyed, resulting in humans at risk for exposure to the weather. Most areas do not have the infrastructure in place to handle these severe weather events because they built the area based off of historical weather patterns that don't take into the account the unpredictability of climate change. Then we have Madagascar's drought. It's the first drought directly linked to climate change. It's occurring in the southern part of the island. It's impacting 1.14 million people who are now in food insecure, and 400,000 people are heading towards famine due to the severity and duration of this drought. Why is this occurring? It's because of global warming. It's disrupting those global weather patterns, which is resulting in the rain that normally comes to not come. So crops that were tried to be grown are not able to thrive, and therefore farmers aren't able to provide food for themselves or their communities. As this drought persists, there's increasing desertification of land, making once arable land usable to becoming unusable. The impact of climate change on human health is all encompassing. We live in our environment. This environment is changing as a result of our actions. There's 7.9 billion people currently on the planet. Our population's growing. Climate change is predicted to get worse before it gets better. And so we all need to take this into consideration.
This is Boran Park. We are going to talk about actions and global frameworks for climate change. We choose an organization is United Nations. They join business ambition for 1.5 Celsius action. It is an urgent call to action from a global coalition of UN agencies, business, and industry leaders in partnership with the Race to Zero. Over 900 companies have responded to the open letter from global leaders and signed the business ambition for 1.5 Celsius commitment. It has long-term goal is called net zero recovery target. It is long-term science-based target to reach net zero value chain greenhouse gases emissions by no later than 2050. It sets science-based target across all relevant scope in line with the criteria and recommendations of the science-based target initiatives. United Nations has frameworks. It is UNFCCC. Its UN Framework Convention on Climate Change is established in 1994 and became the foundation for all future accords. It has goals to prevent dangerous human interference in the climate system. They discuss about human activities contribute to climate change. And also, to tackle climate change and its negative impacts, world leaders at the United Nations are going to participate in the conference in Paris. It is called the Paris Agreement. It includes long-term goals. It is to global greenhouse gases emission to limit the global temperature increase to 2 degrees. They review countries' commitment every 5 years. They provide financing to developing countries to mitigate climate change and strengthen resilience and enhance abilities to adapt to climate impacts. Climate change is affecting every country on every continent. It is disrupting national economies and affecting lives. Weather patterns are changing, sea levels are rising, weather events are becoming more extreme. Although greenhouse gas emissions are projected to drop about 6% in 2020 due to the travel bans and economic slowdowns resulting from the COVID-19 pandemic. This improvement is only temporary. Climate change is not on pause. Once the global economy begins to recover from the pandemic, emissions are expected to return to higher levels. So, the United Nations has suggested to SDGs. Of the 17 goals, number 13 is directly linked to climate change. It is for urgent action to combat climate change and its impacts. However, all of the goals can influence climate change. For example, number 12 is related to consumption and production. It can also affect to climate change. And number 7 is related to clean energy. So clean energy is also related to climate change. So that's why we consider all of the goals can influence climate change. And also, UN has campaign for individual action. It is called Act Now. Our lifestyle have profound impact on our planet. Around 2/3 of global greenhouse gases emissions are linked to private household. The energy, food, and transport sectors contribute about 20% of lifestyle emission. From the electricity we use to the food we eat, the way we travel, we can make a difference. These images can impactful in individual actions. Every one of us can help limit global warming and take care of our planet by doing these actions.
Discussed by Boram, a step in the right direction. Goal setting and guidelines work in tandem to create the unity required to combat climate change and its effects. However, executing the goals and taking the necessary action steps is the most important part of the process. Where are we to date? What have we achieved? This excerpt from the UN Sustainable Development Progress Report shows that climate change is still occurring much faster than expected. 2019 was the second warmest year on record, loss of biodiversity, indicating that countries are yet to achieve the climate goals that they have set in place. Revisiting the Climate Action Tracker, which evaluates how a country is doing in its goal to reduce greenhouse gas emissions in accordance with the Paris Agreement, a rating system that's used here is basically looking at whether it's critically insufficient, highly insufficient, insufficient, almost sufficient, and 1.5 degrees Celsius Paris Agreement compatible, which is the highest level and shows that they have actually met the Paris Agreement goal. As you can see here, as of September 2021, US's overall climate action rating is insufficient, whereas China and India are highly insufficient in terms of their climate action plans. There are countries such as the United Kingdom, Nigeria, who are almost sufficient in attaining the Paris Agreement goals. However, the majority of countries still have a long road ahead. So let's take a look at the UN and what they have done to date. So first, starting with the United Framework on Climate Change. Basically, they required frequent meetings between ratifying countries known as the Conference of the Parties, or COP meeting, which you all know will be held next week in Scotland. So by 2019, it was ratified by 197 countries, including the United States. However, this system did not legally blind signatories to reduce greenhouse gas emissions. So the next agreement that was in place, which was one of actually the first main agreements, was the Kyoto Protocol. And this worked towards regulating higher income countries to reduce emissions, but not lower and middle income countries like China and India, who are high carbon emitters, also high carbon emitters. One of the next agreements was the Cancun Agreements, and this was actually the first commitment to keep global temperature increases below 2 degrees Celsius. Approximately 80 countries, including the US, China, and India, submitted their emission targets and actions. From this, the Green Climate Fund was established, and the goal was to have 100 billion in place to assist lower middle income countries develop climate mitigation and adaptation plans. However, as of 2019, only $3 billion was contributed, and this would probably also be affected too by the recent pandemic. Next, looking at the UN Sustainable Development Goals. So as mentioned before, number 13 specifically deals with climate action, but the other 16 do impact climate change. Therefore, action plans need to be implemented within their regimen to suit their goals missions. Also, too, the goals do not address the inequities within countries. So not all countries are going to be able to implement the required action steps to address climate change due to cost and other pressing current issues, such as war, famine, COVID-19. Next, adaptation of the goals on a regional and local level. That's also very important because the goals are made by higher income countries with their societies in mind, but may not necessarily take into account low and middle income countries that do not necessarily have the same systems or government structures. So there needs to be a balance between the higher income and the lower middle income countries to work towards achieving our climate goal. And accountability. We have to make sure that everyone is held accountable. The Paris Agreement. So the Paris Agreement requires all participating countries to set emission pledges and their progress towards the goals evaluated. However, the manner in which the countries' efforts are evaluated are still undergoing negotiation. Next, the goal of the 1.5 degrees Celsius. That has actually been said to not be aggressive enough. And especially according to the latest report from the Intergovernmental Panel on Climate Change, this report actually stated that these levels will be reached or exceeded within the next 2 decades, even if there's a drastic cut in emissions. And that is very important to note because this report actually came out this year. And we actually have the upcoming climate change conference, as I mentioned, in November, which will be held in Scotland. And one thing here is that for this conference, each country needs to have submitted a national climate plan by the 31st of July of this year. So that would have given the United Nations Framework Convention on Climate Change, UNFCCC, time to review and summarize the changes and updates that each country has made to their National Climate Action Plan to present at this meeting. 60% of the members have actually submitted in time for the deadline, but China and India, who account for about 1/3 of the global greenhouse gas emissions in 2019, did not reach the deadline again. So again, accountability to overall agreement. Each country needs to pull their weight. Next, here we are actually looking at governments. So governments do play a major role in our fight against climate change. And of course, they're well-intentioned, they set their country's goals and agreement, but agreement is required from within their government, which is not always the case, as you have to deal with climate deniers and other oppositions that occur within the governments. And as I use the US as an example here, President Biden has actually announced a very aggressive climate action plan for the US. His goal is to cut emissions 50% from 2005 levels by 2025. And part of his plan encompassed replacing the fossil fuel industry with wind, solar, and nuclear energy. However, this was dropped due to opposition from Senator Joe Manchin III, as you can see here in the picture, because he was concerned about the economy of West Virginia, because he felt that the economy was severely impacted if this plan were in place. But if you're going back to actually understanding the science of climate and change, a recent report showed that West Virginia is the most exposed state to flooding. 61% of power stations are at risk, along with 46% of roads. So the burning of fossil fuels, again, is science, emits greenhouse gases, which warms up the air. So this causes the air to hold more moisture, leading to more intense and frequent rainfall, which causes flooding. So keeping that in mind to consider in West Virginia. Next, we'll look at a couple of solutions here. First, starting on a high level and looking at the World Bank. So many of the lower income countries do not necessarily have the means to implement the necessary measures to combat climate change. So the World Bank has come up with a climate change action plan for the next 5 years. And the goal of this action plan is to, 1, increase climate finance to reduce emissions, 2, strengthen climate change adaptation, and 3, align financial flows with the goals of the Paris Agreement. And these infographics just give you a brief overview of exactly step-by-step what the challenge is, the amount of money that is expected, trillions of US dollars required in developing countries every year through 2030 to build infrastructure. And then next, going on to show, again, just step-by-step, aligning with the Paris goals, July 1st, 2023 to July 1st, 2026. And here, this is an example of a climate finance plan in action. This shows Egypt protecting the Nile Delta. So a quarter of its population, so this is about a quarter of its population, but it's responsible for half of its economic activity in agriculture, industry, and fisheries from sea level rise, extreme weather, and other climate fallout. This one here, this picture here shows a program in Nepal promoting rural energy for rural livelihoods and has implemented an off-grid clean energy solution, such as the expansion of solar and hydro, which is being implemented here to help with the agricultural system. And also to note with Nepal, their goal is to be a carbon neutral tourist destination by 2020. And they've already been internationally recognized for better managing resources to finance climate action. And also part of the solution are governments, the private sector, and non-governmental organizations. So it's important that everyone plays their role in the fight against climate change. So it's a team effort. And as you can see here, they're all linked together. But governments do have an even more critical role in the shaping of the policies that impact climate change. So as mentioned before, the National Climate Action Plan is where the governments outline their agenda. The next step is to take this action plan and move from a high level down to the grassroots level. So using the US as an example here to show the role and impact of government at a federal level. At a federal level, as you can see here, just a couple of examples. One, requiring federal agencies to create programs and initiatives to adapt to climate change within their agency's mission and operations. Another way is the formation of agencies such as the Council on Climate Preparedness and Resilience to focus on adaptation and how federal agencies are implementing these adaptation strategies. State level examples here, Pennsylvania, policies to encourage the use of green infrastructure and ecosystem-based approaches for managing stormwater and flooding. Then in California, building standards mandating energy and water efficiency savings, advancing both adaptation and mitigation. So state plans call for 20% reduction in per capita water use. And on a local and regional level, you can see here with New York City, partnership with Federal Emergency Management Agency, FEMA, they have actually updated their flood insurance rate maps based on more precise elevation data, which, as we know, is very much needed now. So just a couple examples here showing how at each level the governments play a role in the impact. Next, we looked at NGOs in non-governmental sector here. So NGOs provide assistance to the overall efforts with planning, guidance, implementations, tools, best practice exchanges. And these are a few examples here that to highlight that. One being the climate information providers, and those are organizations with that help, such as the Union of Concerned Scientists, the Urban Climate Change Research Network. So organizations that basically overall help the government to, as well as, and also to reach down to the grassroots level, dealing with individuals. Next, to take a look at the private sector. So there are many examples of action now in the private sector because most businesses now are aware of the environment and their impact on the environment. So they are implementing sustainable action plans into their overall business policies and their core values. So they're analyzing the impact of how their business practices are, what the impact of their business practices on climate change and implementing the policies for this. So an example here, Coca-Cola, since it's a very international company and everybody knows Coca-Cola, and you could find Coca-Cola anywhere. First, looking at the fact that one of their goals is to reduce greenhouse gas emissions by 25% by 2030 through their science-based target program. And that's working towards achieving a goal of net zero emissions by 2050. And at the end of 2020, they actually reached their goal, which was the 25% reduction of the carbon footprint of the drink in your hand, as you can see there in the picture below. And just to remember here, the key with the solutions, besides creating a national climate plan, is the implementation and execution of the plans, and the steps needed to be in place. The monitoring and the evaluation needs to occur in a revision, constant revision to make sure that the solutions are effective. Do you need to make changes? Are there updates that need to be made? So again, that's all going in hand with everyone working together. This slide here outlines the main services of public health while highlighted corresponding climate change examples of what needs to be done to achieve the service. So basically just tying everything together. So let's look at number 8, for example. The services to ensure competent public and personal healthcare workforce climate change. And the climate change example is training of healthcare providers on health aspects of climate change. So basically this is all just tying everything together to show us that, yes, public health does play a role. Public health principles do play a role in helping us mitigate the effects of climate change. Next, we'll have Claire that will discuss the priority areas for action.
Okay, and lastly, I will be discussing very quickly some priority areas for action that we have chosen and that we foresee if we can make these areas a priority, we will see the most impacts in the coming years. So the first areas for action go through governance. So we need action at a global level. So all nations need to recognize climate change as an issue and they need to implement actions to stop climate change. We can't just have one country or a few countries or even 90% of the countries doing their due diligence. We really need everybody to come together as it's a global issue. We also need actions to be taken at the national level. So of course, going, off our previous global, at a national level, we have to be making a global commitment along with all other nations. But not only that, the people must be made aware and they need to hold their country accountable. So if we aren't holding our country accountable, we won't be making our global commitment and we won't be reaching the impacts that we need to make to start tackling climate change. All right, and our next area of action is through healthcare systems. And the first area of action we thought was through infrastructure. So as we've mentioned previously in the presentation, our current infrastructure cannot withstand some of our current weather events and the weather events that are predicted to happen in the coming years. So we really need to create climate resilient hospitals and community health centers. Without them, or if we weren't to create climate resilient hospitals and health centers, we would be left with buildings that are degrading through these severe weather patterns, and then we won't have anywhere to take care of our sick people or people who need medical care. So that's a really big one. Then we also thought to take action through personnel. So we need to train people within the medical community on communicable diseases, and especially diseases that haven't historically impacted on them. As Grace mentioned previously, vector-borne diseases are very much real and very much happening. So we are seeing some diseases that were, never in one area starting to appear. And so we really want people in our medical community to be educated and trained on these diseases so that they aren't left to themselves on figuring out how to treat their patients or what to do. As well as gathering data on these diseases and their spread so that hopefully, there's just not a lot of data out there right now. So we could really use that to help and to be tracking their spread so that we can kind of get ahead of the game. All right, thank you guys so much for listening, and that is it.